Welcome to Brainetainment, where we strive to entertain your brain with fun and informative content. Today we're shifting gears a little to tackle a topic that's both important and relevant to us all: the symptoms and early warning signs of breast cancer. This isn't about instilling fear, but rather, it's about empowering each and every one of us with knowledge. Knowledge that could potentially save lives. Breast cancer, like many other health issues, is often more manageable when detected early. That's why being informed about its symptoms and early warning signs is absolutely crucial. It allows us to stay vigilant, to be proactive about our health, and to take timely action when necessary. So, whether you're here for yourself, a loved one, or simply to expand your knowledge, we commend you. Knowledge is power, after all. Stay tuned as we delve deeper into the symptoms and early warning signs of breast cancer. To understand the symptoms, it's essential to first understand what breast cancer is. Breast cancer is a disease where cells in the breast grow out of control. It's not restricted to one gender, despite being predominantly associated with women. Men too can fall prey to this disease, although instances are considerably rarer. This disease typically starts in the ducts that carry milk to the nipple, or in the glands that produce milk, known as lobules. So how does it all start? Well, when the body's cells begin to grow and divide in an uncontrolled manner, it leads to the formation of a mass or a lump, which we commonly refer to as a tumor. Not all tumors are malignant or cancerous, some are benign, meaning they are not harmful. However, those that are malignant have the potential to invade nearby tissues or spread to other parts of the body, a process known as metastasis. Now, who is at risk? The risk of breast cancer increases with age, and those with a family history of the disease have a higher risk. Certain gene mutations like BRCA1 and BRCA2 also significantly increase the chances of developing breast cancer. Lifestyle factors such as alcohol consumption, obesity, and lack of physical activity can contribute to the risk as well. But here's the thing, having one or even several risk factors does not necessarily mean you'll get the disease. Many people with risk factors never develop breast cancer, while others with no known risk factors do. Therefore, it's vital to maintain regular checkups and screenings. Why is early detection so important? Early detection of breast cancer significantly increases the chances of successful treatment. When breast cancer is found early, the 5-year relative survival rate is nearly 100%. That's why regular mammograms, which can detect tumors before they can be felt, are so crucial. Now that we have a basic understanding of breast cancer, let's move on to the symptoms. One of the first steps towards early detection is knowing the symptoms. Breast cancer, like many other diseases, presents a host of symptoms that can alert us to something not being quite right. A common symptom that many of us are familiar with is the presence of lumps in the breast or underarm area. These lumps can be hard and have uneven edges, but they can also be tender and rounded. It's important to note that not all lumps are indicative of cancer. They could be benign growths or cysts. Nevertheless, any new lump or change in an existing lump size or feel should prompt a visit to your doctor. Another symptom to watch out for is a change in the size or shape of the breast. This could be a sudden change or a gradual one that you notice over time. It's normal for our bodies to change as we age, but drastic and unexplained changes in the breast could be a sign of something more serious. The skin on the breast can also show signs of breast cancer. This could manifest as dimpling, much like the skin of an orange, or it could show up as redness or a rash that doesn't go away. It's also important to pay attention to the nipple. If it starts to turn inward or if there's a discharge other than breast milk, these could be signs of breast cancer. Finally, any pain in the breast or nipple that doesn't go away should be taken seriously. While breast pain can be associated with our menstrual cycles, persistent pain is not normal and should be checked out. Remember, these symptoms don't automatically mean you have breast cancer. They are, however, signs that you should consult your doctor. It's always better to err on the side of caution when it comes to your health. Being aware of these symptoms can be the difference between early and late detection. Let's now look at the early warning signs. Early warning signs often go unnoticed, which is why being informed is vital. Breast cancer, like many other diseases, often presents subtle signs before it fully manifests. These signs may seem insignificant or unrelated, but they are nature's way of sending a distress signal, and it's important to heed the call. One of these early warnings could be a change in the appearance of the nipples, such as newly inverted nipples. Inversion means the nipple, which usually points outward, has started to pull inward or retract. While it's true that nipple inversion can happen naturally or due to aging, a sudden change can be a cause for concern. It's always best to consult with a healthcare professional if you notice such changes. Another early sign may be nipple discharge that isn't breast milk. It's not uncommon for women to experience some form of nipple discharge throughout their lives. However, if the discharge is new and not associated with breastfeeding, it's best to have it checked. Discharge can be clear, yellow, green, or even bloody. While most nipple discharge is not cancer, bloody discharge can be a sign of breast cancer and should be evaluated by a healthcare professional. In addition to physical changes, you may experience discomfort or pain in your breast or underarm area, not related to your menstrual cycle. The pain could be persistent and not necessarily localized to the lump area. Remember, these signs don't conclusively mean you have breast cancer. Many benign breast conditions can cause similar symptoms. However, it's always better to err on the side of caution. Regular checkups and self-examinations are crucial in the early detection of breast cancer. Awareness and proactive action are our best defenses against this disease. If you notice any of these signs, don't panic, but do reach out to a healthcare professional. Knowing these early warning signs can potentially save lives. Now let's summarize what we've learned. It's been quite an informative journey. Let's recap what we've learned. Breast cancer, a disease that sadly affects many, is a condition where cells in the breast grow out of control. It's not exclusive to women, as men can also develop breast cancer, though it's significantly less common. Understanding this disease is the first step towards prevention and early detection. We dove into the symptoms of breast cancer, highlighting the importance of being aware of any changes in your breast. Symptoms can vary widely, but often include a new lump in the breast or underarm, thickening or swelling of part of the breast, irritation or dimpling of breast skin, redness or flaky skin in the nipple area or the breast, pulling in of the nipple or pain in the nipple area, nipple discharge other than breast milk, any change in the size or the shape of the breast, and pain in any area of the breast. However, it's important to remember that these symptoms can also be associated with other conditions, so experiencing one or more of these doesn't necessarily mean you have breast cancer, but it does mean you should consult with a healthcare professional to rule that out. Early warning signs of breast cancer were also discussed, reminding us that early detection is key. It's crucial to note that not all people experience the same warning signs. Some people do not have any signs or symptoms at all. The importance of early detection cannot be overstated. It increases the chances of successful treatment and survival. Regular self-examinations and screenings are vital tools in the early detection of breast cancer. In conclusion, understanding the nature of breast cancer, its symptoms, and early warning signs are integral to prevention and early detection. It's vital to pay attention to any changes in your breasts and consult a healthcare professional if you notice anything unusual. Remember to consult a healthcare professional if you notice any of these symptoms or signs. Thank you for tuning into Brainetainment. Don't forget to subscribe for more informative and entertaining content. Stay informed, stay healthy.